All right, this is the military trauma PTSD rotation. I am Dr. Ryan Coppens, and joining us we have Dr. Nicole Murray. So we'll kind of go through this presentation to help you understand a little bit about what our rotation is, what are some of the expectations, and what you could look forward to if this is a rotation of interest to you.
So let's talk about, what we treat kind of here in our clinic. So we primarily focus on treating PTSD and also other trauma and stressor-related disorders, which we kind of conceptualize as subthreshold PTSD. And these have to be related to kind of active duty traumas. So this could be situations like combat, or it could be something that occurred during training, witnessing suicides, just while on active duty or within the military. And we don't typically see non-military PTSD or MST. We typically refer those out to our MST clinic or mental health clinic. But a lot of our veterans who do have military PTSD have other traumas from other parts of their life. And so you have the opportunity to maybe treat some of those kind of within the clinic as well, if that's kind of the area they want to focus on kind of within treatment with us.
In general, what you can expect from a standard week here in our rotation, usually it's going to be about 5 therapy cases, plus 2 PTSD, kind of more comprehensive evaluations, and 2 feedback sessions with those same individuals following those evaluations later in the week or the next week. No groups likely along our rotation. It's really focused on individual. The supervision is going to be 2 hours, split between myself and Dr. Murray, 2 supervisors. All emails, all communications, Teams messages will include both of us. So we're both supervising all the cases, kind of all informed so that it's a full group approach.
And when we do therapy within the PTSD clinic on this rotation, we're kind of primarily having the intern focus on learning things like cognitive processing therapy and prolonged exposure. But there's also opportunities for other interventions like trigger, trauma-informed guilt reduction therapy, or CBTI, or cognitive behavioral therapy for insomnia, if that's an interest that you have kind of while you're on the rotation. Interns will kind of have opportunities while they're here with us to kind of attend VA trainings for CPT and do the consultation following that, and also get to have training on trigger as well while on rotation. And PE can be an option, certainly, depending on the trainee's interest and kind of what you're wanting to focus on while you're on rotation.
In terms of the evaluations, we evaluate every veteran who's been referred to our clinic to see if they're appropriate for some of the specialized treatments in our PTSD clinic. So 2 PTSD evals a week using the gold standard CAPS-5 clinician administered PTSD scale. First, you start off kind of watching us do it, then you would do it while we're watching you, and then you kind of do them on your own. The goal is to understand if they're meeting that full criteria for PTSD, again, due to an active duty military trauma, or if they're meeting a trauma disorder, which in our clinic would be at least that criterion trauma, and they're having those re-experiencing symptoms and the avoidance symptoms, and therefore benefit potentially from a trauma-focused, evidence-based practice therapy here in our clinic.
So in terms of our population and kind of who we see here in the PTSD clinic, we have a lot of diverse kind of veterans within our clinic. They tend to be a little bit higher functioning because Tampa is a really big relocation area for a lot of members of the military. And we have MacDill Air Force Base and then SOCOM and CENTCOM, where a lot of our veterans do work kind of as civilian contractors, still kind of for the DoD and for the military. And so we have a lot of people who've retired recently from the military, veterans who kind of served for a long time and therefore higher ranking compared to maybe other regions of the country. And it's also a very big transplant location. And a lot of people are moving to the Tampa Bay area. So we have veterans really from all over the country who are coming here. So there's a wide range of other diversity factors, such as kind of what branch they're serving or they come from in terms of service, and also kind of different races, ages, genders, and sexual orientations. So interns can expect to have a really diverse clinical caseload on the rotation.
As a whole, what our clinic looked like, it's got primarily psychologists. We have a handful of psychiatrists. We've got a couple LMHCs, hiring into another social worker here. Cases are shared amongst the team, so we're all kind of working with a variety of different providers here. And so we're often seeing the same veteran for different reasons here. In terms of kind of what you can expect, we've got case conceptualization meetings once a week. As of now, it's kind of, Monday afternoons talking about this is the case. Is this a good fit for our clinic? What type of treatments would be best fit for this individual? We also have a PTSD clinic staff meeting that interns will be able to attend, getting to know kind of the behind the scenes, what's going on, what changes are coming up in the clinic, what types of things are we trying to adjust. And there's a trauma seminar didactics twice a month, going over all kinds of different didactics related to trauma, whether that's sleep or dissociation, or it's presentations on other intern or postdoc dissertation aspects, but topics directly related to trauma.
So interns that are really successful on our PTSD clinic rotation when it comes to military trauma are typically interns who have really strong time management skills. It's a fast-moving clinic. We have a lot of veterans that we see, and there's a lot of documentation that comes with that. And so typically you can expect to have around 7 therapy/feedback session notes in a course of a given week, as well as kind of those 2 PTSD really thorough clinical evaluations that you're doing per week. And so that demands a lot of time, and we have really high expectations of kind of getting those done within, time limits that the interns have. And there is opportunities to kind of complete a comprehensive assessment during this rotation as part of kind of the general internship requirements, because testing is done on a regular basis here within the PTSD clinic. And so you can also test a kind of PTSD clinic veteran for comorbidities or things like that as part of this rotation too.
Interns who are more likely to potentially struggle are interns who might take a really long time to complete or write up progress notes, whether that's difficulty focusing or overall perfectionism. Like I said, it's a fast clinic, so making sure that those notes are in there so you can continue to move on to your clinical needs. Others might struggle with identifying diagnostic criteria quickly. Is this PTSD? Is this something else? Is this related to their deployment, but maybe not PTSD? Or interns who have difficulty. In the same day, you might do an eval in the morning, and then midday, you might do a CPT case, and then later a PE case. So being able to bounce around based on kind of the clinical demands and what might be needed at that moment.
And so our contact information is included on this slide. If you have any additional questions about the rotation or things we can maybe help answer in order to kind of help make some decisions about your internship over the course of the year, please just go ahead and reach out to us via Microsoft Teams or via our emails here. And we're more than happy to answer any additional questions you might have.
We'll stop the presentation. We'll turn on our cameras and we'll talk a little bit more about us, the kind of goals for the rotation. So Dr. Murray, if you want to start.
Yeah, absolutely. So supervisory style for me, I really value a lot of authenticity and transparency, with the interns. Like working in a PTSD clinic, it's really fast paced. Like we said, there's a lot going on. And so being really like authentic about kind of what that experience looks like, helping interns with their professional development, as well as kind of their clinical acumen, and really kind of bringing up a lot of those skills and strengths. And, we really try to meet the intern where they're at, just like we kind of meet our veterans where they're at in treatment, and kind of focus on whatever the growth areas that you're wanting to work on, whether that's a specific treatment you want to learn, or whether that's kind of maybe getting some additional assessment experience or kind of working on those conceptualization skills. We really value that kind of, helping to really bridge those gaps and kind of really helping interns really kind of broaden their scope and understanding of PTSD, because you're going to see it if you choose to work in a VA system. So I think that's kind of a lot of the goals that we have for our interns, and I'll let Dr. Coppens speak to his ideas as well.
Yeah, kind of echoing that same sentiment in the sense of meeting the intern where they're at, but focusing on the goals of when this rotation is over. Really want you to feel comfortable in understanding what is PTSD, how do I diagnose it, how do I see it, how do I differentiate it from some of the many other concerns that can come from military service or things that they may have experienced during that time, and also being able to comfortably treat it. CPT, PE, what can be beneficial, even if you're not doing some of those other treatments in the clinic. How do we help our veterans that are struggling with this? And so that's our goal. How do we help the interns to get to that? So if that's an interest of you, please look forward to answering any questions you have about our rotation. And otherwise, we'll potentially talk to you in the future.